High deductible health plans have brought down the cost of health insurance for many people. That's the good news. The bad news, when you have to use that insurance, it's now often a case of sticker shock. Mike Zipfel is a hard-working dad who normally watches every dollar. Come here, Bubba. Until the recent night when his 5-year-old son cut his chin.
Here, middle of the night, rolled out of bed, bumped his chin on the... We have a bedside table.
It was just a small cut, but Zipfel decided to go to the nearest ER.
He took a look at the wound and he said, you know, this doesn't need sutures. We've got the super glue.
But Zipfel almost needed surgery on his own head when the bill arrived.
It was shocking.
$600 for the hospital, almost $500 for the doctor.
So overall, it was about a $1,000 visit.
2 months ago, Kelly Lures took her son to an ER for an ear infection.
Basically, it was like going for a doctor's visit, except at the end of it all, we ended up with an $899 bill.
$900 for an ear check and prescription. So what happened to the friendly ER doctor and that low $50 copay? Well, the doctor's still friendly, but low copays are a thing of the past thanks to those high deductible health care plans.
More people are exposed to higher deductibles.
Kurt Lewis is executive director of United Healthcare. He says most people have no idea the same procedure can cost hundreds more or less in a different town or at a different hospital.
People really don't know what they're paying until they get the bill.
A New York Times investigation found the typical ER visit includes a $400 facility fee, a doctor's fee of $200 to $1,000, and $400 in lab fees or x-rays. Even a trip to your primary doctor can cost $2,000 if you need an MRI. That's why knowing the cost in advance is essential. United Healthcare has a new website called My Healthcare Cost Estimator. Aetna has a similar tool called Member Payment Estimator. Anthem Blue Cross has a cost estimator site. They'll name specific local doctors and their cost. Meantime, anyone can use Healthcare Blue Book that gives a rough estimate of what a procedure should cost. Finally, Lewis suggests checking out independent facilities such as private MRI centers and urgent cares, which can be a fraction of the cost. Mike Zipfel will do that next time.
Obviously, it's a case where you got to know where to go and where not to go.
Caution, if you have a serious injury or something seems life-threatening, go to a hospital emergency room immediately. But if it's not urgent, compare prices in advance so you don't waste your money. I'm John Matarese, ABC 2 News.